But Dr. Mercy Korir breaks that down in this report.
Do you find yourself having to choose between your health and your other expenses of daily living like food? You're not alone. Millions of people in Kenya and across the world find themselves at this crossroad oftentimes than not. Kenya embarked on an ambitious journey to achieve health for all by the year 2022. And although the pilots in Isiolo, Kisumu, Nyeri and Machakos counties are facing hiccups, the government says it is on course.
The program has witnessed enhanced access to essential health services with an average increase across the pilot counties of 39% reported.
Inadequate funding for health and underinvestment in the health workforce are still the major causes of a sick health system, as witnessed in Kenya and Africa.
It's important that the basic health services are actually funded by government. It implies that it comes from taxes, from revenue that are raised by the government.
This calls for a serious look into sources for a sustainable funding model.
We have created the sports fund, special fund, where 65% of that money from betting and lottery will go to funding universal health care.
4 months since the pilot, what has Kenya learned on its course to a point where anyone can access essential quality health services without facing financial hardship?
Within the counties, there's a lot of work to do to be able to handle the medicines better. And then, of course, the whole disbursement of funding back to the facilities.
This means that an efficient way and channels for money to flow to all the 47 county public health facilities has to be considered seriously.
So I think we should do the monitoring of the current pilots better. So the pilots currently are underway, but we're not fully on board yet to monitor those pilots, both in terms of their outcome. So is there better health outcomes from that, but also from the process. It's not only the provision or the access of the services, but really the quality as well. And this is, of course, where the health workers play a huge role.
At the center of all this is a committed leadership and governance that ensure a people-centered health service delivery system and not just proclamations of commitment without action.
We are on course for the full rollout of the universal health coverage in the year 2019-2020 in the remaining 43 counties.
While the President reiterates his promise to provide health for all, what Kenyans should continue demanding for is its actualization, not just proclamations of financial protection, but also assurance of accessibility and availability of quality public health services whenever they need it and wherever they need it.